else would you go? It's the perfect city for uni in so many ways, because compared to somewhere like London, for example, it is so much cheaper. Like the cost of living, the cost of rent, the cost of going out, it's so much cheaper. So you can do the things that you want to do. Yeah, it's a city that has everything. All right, it might only have one top shop, although I think there might be 3 top shops actually, if you include the metro centre. It might only have one of everything, but it's got everything pretty much that you need, that London has. London just has 20 of them. The people are much more down to earth, people are friendlier. So for me, I mean, for a lot of you guys, you're from the northeast, you know it anyway, but for me, I wanted to move away from home. And Manchester is the nearest city, but it was still a bit close to home. Leeds, still a bit close to home. Newcastle was far enough away. I wanted to get away. But the people are lovely. Like I felt like an honorary Geordie. So there's that. And just the sunshine. Yeah, it's cold, but the sun shines a lot in Newcastle. You're close to the coast. You can get across to like Kildare if that's your thing. I think it's a beautiful place for so many reasons. So yeah, I mean, Newcastle through and through. Where else is there? You will always have challenges as a doctor, but part of what medical school does is it prepares you for those challenges. And again, I think having had lived experience, having lived life, and life not always being perfect, prepares you even more than the medical school does. My advice always is when you actually, like, you know, medical school, you've just got to get your head down and do the work. I had 3 jobs through medical school and was vice captain of the women's rugby team and still managed to pass with merit. So it's very doable. And when you become a doctor, I think it's International Nurses Day today. Respect the nurses. That's the biggest advice I can give you. When you actually become doctors, remember who's in charge. It's not the consultants. It's not the professors, it's the nurses, especially the senior nurses. They're the ones who've been there forever, for 40 years, 50 years. They know how it works. They will tell you when this really mean surgeon is going to come in today and they're going to try and break you because they're going to be mean. Just say this one sentence like, oh, do you like horses or whatever. They're the ones, if the nurses are your friends, then you can't go wrong. So yeah, always be kind and just respectful to the nurses. Social prescribing is something that's always existed. Dr. Thistlethwaite gave me a social prescription of physical activity. But in recent years, it's something that has become much more and continues to become much more established. Matt Hancock, I won't say too much about Matt Hancock, but when it comes to social prescribing, he's been great. He's been good with that because he used to be the Minister for Arts and Culture. So when he's come into being the Minister for Health, he already recognises and understands the importance that things like arts and culture can have on a person's mental and physical health. So one of the things he's really put a lot of money behind and backed is social prescribing. He's created this. I actually heard him talk at an event about 3 years ago, and it was a social prescribing event held by the King's Fund in London, and I'd given a talk, and he came and he said at the end of his talk, he said, and I'm going to create an academy for social prescribing. And everyone was like, whatever. Anyway, he did, true to his word, he did. He's got the right people in place running it. So we're seeing a huge shift towards recognising that whilst there's a place for drugs and surgery and the things that we do to people, there's also a huge place for people finding what they need within their local communities, and often delivered by the charitable sector or the or local organisations. So it's kind of becoming like social prescribing. It's always been this thing that people do differently and it doesn't have a name. Now there's the development of the link worker, who is a non-healthcare professional who will work with healthcare professional teams to lead on social prescribing. So what that means is, as a GP in my 10-minute consultation, my patient who's got chronic headaches for 20 years, we're always changing their medicines. I can make a medication change and refer them to the link worker. And the link worker will spend half an hour with them, really get to know that person inside out, what's their, not just like the fact that they have headaches, they have pain, how does that impact on their job, how does that impact on their relationships, how does that impact on every aspect of their life, and then offer solutions and support. So yeah, there's a lot happening in social prescribing. If it's something, whoever asked that question, if it's something that you think is interesting, to get up to speed and get involved in social prescribing programs in your local area at this stage would be a really smart thing to do for your future career. That's difficult. We all have different revision strategies, I think, don't we? My strategy was, and I'm not recommending this for anyone, it worked for me, but I just sort of lived my life like normal until 2 weeks before the exam, and then did nothing but revise, library, 8 till 8, 7 days a week, revision, nothing else, bit of exercise in between, go for a run. I used to play basketball with some of the lads on my course actually, halfway through the day. But that's what I did. I'd cram for those 2 weeks and retain that information in my brain and do the exam. When it comes to motivation, I think it's so hard, especially when you're working from home and you're stuck in that environment. Break it down into small chunks, because it can feel like a mountain to climb. So don't give yourself too much to do in a day, and break it up with other activities. Try and get an hour's worth done, and then do cleaning your room or doing your washing, or those things that you never actually want to do except for when it's time for revision. And exercise really, really helps. It really helps your brain to switch off and have a break, but also sleep. Don't forget the importance of sleep when you're revising, because your brain cannot lay down what you've learned. It can't form memories, and can't store all that information if you're not getting good sleep. So exercise, sleep, basically lifestyle medicine, good nutrition, but give yourself some time off as well. If you know you've got time off coming, you've got a break, you're much more likely to be productive in that hour, 2 hour stint that you give yourself. So yeah, people often ask me this, that do patients walk in and just want to know about Holly Willoughby and stuff? People do sometimes walk in. I think only on 2 occasions, patients have just been a bit overwhelmed and said they didn't feel comfortable sharing whatever it was. I think that's happened twice in all these years. But often what tends to happen is the patient will walk in who I haven't seen before. They're like, oh my gosh, you're that doctor off the telly, Dr. Zoe. I'm like, yeah, hi. They're like, oh, wow, amazing. Anyway, they know they've got 10 minutes. Anyway, that's great. But doctor, the reason I'm here, and that's it. So usually after a few seconds, that's pushed aside. There've also been a few occasions where it can be dangerous, actually, because the media really influences us and how we think about the people that we see in the media. So I've had a number of patients who, it kind of works in my favour, especially when it's the situation where a patient comes in, they've got a sore throat, they come in, really what they want is antibiotics. And as a doctor, it's probably not the right thing, but how you have that conversation, there are different ways of doing that so that the patient leaves happy, but with the right treatment, which is not antibiotics. And I remember the first time it happened, it was a lady, and she walked in and she was like, that I'm walking out of here with a prescription for antibiotics. That's what she was doing. And in the end, she said, look, because you're on the telly, you must be really, really good. So if this was anyone else, I'd battle you, but because you're on TV, you must be one of the best doctors in the country. So I'll take your advice. I'm just the same as all the other GPs in my practice. So most people, they quite like it. I guess they get to go home and say, oh, I saw that doctor off the telly. Sometimes I find it a bit weird, especially if I've done this in the morning and then I'm seeing them in the afternoon and I've still got my full face of makeup on. They're a bit like, how did you get here? But yeah, it doesn't really cause any problems.